When it comes to acid reflux and severe heartburn, you may think relief comes over the counter, but there could be some bigger problems lurking under the surface. My next guest says, don't treat the symptoms, get rid of the problem. In fact, he wrote a book on it. Here is the author of 10 Reasons to Not Ignore Reflux or Heartburn, Dr. Clifton Thomas, and his patient, Elaine McShane. Good morning.
Good morning.
All right, as we talked about a little bit earlier, a lot of us do kind of rush for the over-the-counter medications, which have their place.
Right. So the medication's been around for a very long time, and they absolutely have a place because not everybody needs surgery. But the people that have particularly breakthrough symptoms while taking medication, in other words, they're taking the medicine, but they still have heartburn, they still choke on occasions, all of those people ought to at least look at the option of surgery.
Yeah, and Elaine, people who have not dealt with heartburn and acid reflux don't understand how miserable it can be.
Oh, it's horrible.
It shuts you down, doesn't it?
It does. It interferes with your sleeping, and it interferes with a lot of different things. Your eating, everything. You have to watch it.
Yeah, and you know, you sit down in front of a table to have dinner, and the first thing you got to think is, should I do this, right?
Right. And mine was always, I can't go anywhere, I can't go out of town without my medication because you're really miserable then.
Yeah, and again, that important point, Dr. Thomas, is that you can medicate symptoms, but if you don't get rid of the problem, things oftentimes have the tendency to get worse. What happens when we just keep suffering through it?
So there can be ongoing damage. So a significant percentage of the people, the juices that are coming up are causing damage. The thing that's really kind of spooky that's going on is cancer of the esophagus is rising faster than any other cancer worldwide, and we think it's reflux related. So the medications that are stopping the acid apparently aren't stopping the juices that are causing the potential for cancer of the esophagus. So it's something we need to step up. The world needs to kind of understand that the medications does not fix reflux. It just slows down the main thing that's irritating the esophagus, and it actually does that pretty well.
Yeah, do we know what causes it actually?
Causes reflux?
Yeah.
No, we don't.
Because some people can eat one thing and be fine, other people can,
But the bottom line is like what you're talking in the other segment, parts of our body change, and not all of it's in the exact shape it should be, and that when it's out of shape, just like the drooping of the face and all that, then that one-way valve doesn't work very well. And that's what a hiatal hernia is when that's out of shape. And there's a one-way valve, and that has a particular shape to it. And so what we do at surgery is we repair that hiatal hernia, and we reshape that valve, turning it once again into a one-way valve.
Yeah, before we get to surgery, are there some things that perhaps we could do to alleviate the symptoms? And by the way, what are some of those symptoms? There's the obvious ones, and then there are ones like that dry cough. A lot of times people don't know what that is.
So there's the basic symptoms, heartburn and then choking. Elaine was choking a lot at night when the juices are coming up and interfering with sleep. But breathing problems, for example, asthma, chronic cough, it's number 2 reason for chronic cough. 70% of the people with asthma have reflux. That may be what's causing that.
So sometimes people are misdiagnosed or not fully diagnosed.
At least part of the problem with asthma, if not anything. But then voice changes. People are going around with a hoarse voice or sore throats. That's often related to reflux. A lot of cavities often is reflux. The juices are coming up and destroying the enamel on the and it's really, really common.
All right, well, reflux, I don't like reflux now because there's a lot of bad stuff going on there. But yeah, it does have that domino effect on our health. And if you're not getting enough sleep, we certainly know that your body starts breaking down when you don't get that restful sleep as well. Okay, so who's a candidate for the surgery?
So the typical person is a person that has breakthrough symptoms while taking the medication.
Okay, as you said.
So that was the one. Now people are concerned about taking the medication because they've heard about the potential for osteoporosis and bone fractures, and they've finally realized that the medication is really approved for 8 weeks. So now people are coming in quite a bit, just wondering, can I get off medication? Am I a candidate just so that I can get off medication?
Yeah. Elaine, were you aware that there was a surgery that would fix this?
I was for a while, but I could not get a referral from my gastroenterologist for a surgeon to be fixed. So I took it on myself and just made the appointment and went over.
Yeah. And Dr. Thomas, what advice do you have for that? Because sometimes we do get blocked with something like a referral. And so should we, I guess, to end the suffering, come on in, at least let you figure that out.
Absolutely, come in and download my book so that they kind of get the big picture of what reflux is all about. But yeah, it's a problem. It's a common problem, and more people should be referred to surgery.
Yeah, but Elaine, it's a great lesson to be learned there. You're the one who's suffering. You just had to take matters into your own hands.
And it's a great surgery. You feel so great afterwards.
All right, so I was going to ask you, how do you feel now compared to
I feel great. I don't wake up every morning nauseated, which I used to do that all the time. I can sleep through the night without sitting up. And it's a good surgery.
And can you eat what you want now?
I can, and no more medicine.
Okay, what's the first thing you couldn't wait to just start enjoying again, food-wise?
Food-wise, oh, Lord, spaghetti sauce.
Oh, yeah.
Very good.
Yeah.
That's a common
Yeah.
one. Yeah.
All
Hot
right.
sauce.
What are we talking about in terms of preparing for any downtime?
So the surgery is an outpatient operation. People are usually getting out of the house and doing things in second, third day. Essentially, everybody's doing everything within a week. The incisions are very small, 5 millimeters. So the downtime from the operation is very small.
Yeah, yeah. And once it's done, you're done?
And in relative terms, it's a very safe operation. Complication rates are extremely small.
Yeah. And once you're done, you're done. It's fixed for the most part.
Yeah, well, any mechanical operation can come, but we have very low recurrence rate.
All right. Well, if you would like to download a free copy of Dr. Thomas's book, 10 Reasons to Not Ignore Reflux or Heartburn, or if you want to schedule an appointment with him for a free consultation, you can go to his website at gerdtx.com, gerdtx.com, and you can call this number as well. 713-936-0777, 713-936-0777. The least you can do is make sure that you know that it actually is acid reflux. Also, don't forget to log on to Facebook and let us know if you think